y'all. Hey, what up, though? What up, though? Hey, y'all. Hey, I just want to make sure I got this thing on public so everybody and they mama can see. What up, though? Hey, y'all. Hey, professionals. Hey, professionals. And hey, everybody else, party people. How y'all doing? We are live today because it's May Mental Health Awareness Month, and we are back again to educate you on a mental health disorder. I am Glendora Devine, licensed professional counselor, board certified telemental health provider, and the best business coach to us mental health professionals. Listen, I am greeted today and graced with the beauty of Miss Juana Lyles, LPC, Marquita Thompson, LPC, and Felicia Cameron, LCSW, SAP provider. Y'all, we about to have a great time. Thank y'all for coming in. Thank you, Whitney. Hey, Whitney. And hey, Danita. So before we even get really into it, you guys, I want to make sure that you know that Danita Moss, y'all can see her in my on Facebook, and she's going to be scribing what we're talking about today. If you do need a scriber to help you when you go live, to help you get your message across, so the points can be honestly hit. If you really want them to stick, then reach out to Trinity Scribes. That is the name of her business. Her name is Danita Moss. She is a queen, and you should have her in your repertoire of armor, because I do. Get into it. So, with no further ado, let me tell you what we're about to talk about. We're talking about today in May 10th, we're going to talk about postpartum depression. And so I'm going to let the ladies introduce themselves. And then after they introduce themselves, they're going to tell you about who they are and who they serve and the name of their business. And then after they do that, we're going to come back and we're going to really get into what we're here for today is to learn about postpartum depression.
Well, hello. I'm Felicia Cameron. I'm a licensed clinical social worker for the great hospitality state of Mississippi. I'm also a SAP professional, substance abuse professional. I serve people 18 and above, individuals dealing with anxiety, depression, and coping with life's transition. Thank you.
Hello, my name is Marquita Thompson. I'm a licensed professional counselor here in the state of Ohio. I work with those people within the Black and Brown community specifically to help them to deal with trauma that may have impacted them in generational, childhood, as well as societal. My specialty is in creating a safe space for these individuals to come and to just feel empowered, feel ownership over their story, and as well as just to feel safe. Thank you for having me, Glendora.
Well, hello, y'all. I am your girl, Juana Lyles, licensed professional counselor. I specialize in trauma, anxiety, and depression. My expertise is in brain spotting, CBT, and I also use a prepare enrich curriculum for seeing couples. And as I said, I serve individuals and couples that are ready to start living and not just surviving. I equip people with the tools that they need in order to learn, love, and live again. My motto is yesterday is gone and tomorrow is not promised. So why not live intentionally today? So hit me up at Lit Wellness Center. Thank y'all. And I'm so glad to be here. Good to see you, Glendora.
on mute the whole time. Y'all, oh, I'm so sorry. I'm so sorry, you guys. I'm so sorry. Listen, I'm so good. I'm super glad, like I said, to have Juana up in here as well. Thank you, Juana. Come on, girl. And all of you ladies. I also have Danita. She's coming in too in a minute. But listen, before I even go any further, I want to tell you guys that what postpartum depression is, transparent moment. This is something that I actually had experienced in my life after I had my daughter. And how I realized that I was going through postpartum is I was washing dishes one day and the wind started to blow and I could see the trees moving. Why did I start crying? I don't know why I started crying. My husband would say, what do you want to eat for dinner? Why would I start crying? I'm like, why am I crying? He just asked me what did I want to eat for dinner. He didn't yell. Or the garbage man came down the street and I seen him. And I was like, oh, today is the garbage day. Why did I start crying? Y'all, I was dropping buckets of water for no reason. I didn't understand it. I was like, I got to get to the doctor. I got to see what is going on with this. And the reality was, she said it's called postpartum. All right. It was postpartum depression, and it was basically triggered from me having a baby. My hormones and everything was just thrown off. Now, I did not have any psychosis, but I did have mood swings. What I ended up doing was trying to figure out, like, how can I do mind over matter before I start taking medication in order to kick this. So that was a really big deal. I want to go into right now just talking about some more of the symptoms, and we'll talk more about what is postpartum depression in a second. But let's get into like what are some of the symptoms, because mine was like, if the wind blow, I'm finna cry. So with that being said, I'm bringing up, I do believe it's Miss Lyles. Is that you? Okay, great. Come on up and tell us about these symptoms.
Okay, y'all. So I want to say something first about it, because sometimes it's normal for us to have what we call baby blues. And so baby blues are just where after you have the baby, kind of like what Glendora was saying, but after you have the baby, it only lasts for a few weeks or a few days to maybe a week or so. But after that, it's where these symptoms are not letting up and it starts to be more severe. And so what I'm talking about are some of these symptoms. They include mood swings. And so you can have mood swings like you're happy, and then you're angry, you're, sad and crying. So those are some of the mood swings, or what mood swings look like. And so there will be more severe than just like, constant up and down kind of thing. Okay. And you could be crying too much, kind of like Glendora just said that she was doing, like just because the wind's blowing. Okay. And then there's, one of the ones that I seem to notice the most when I work with clients are the difficulty bonding with your baby. And so especially like those mothers that are doing in breastfeeding. And so when you're breastfeeding and you feel like the baby's not latching on, or if you're not able to breastfeed, because of various different reasons, like for me, I wasn't able to breastfeed my daughter. So I didn't think that I was going to bond with her the same way, but it's still just like, sometimes the baby feels like you feel disconnected from the child. Okay. So that's what I'm talking about when you just have the difficulty bonding. Then there's also withdrawing from your family and friends. So you start to isolate yourself and just kind of become recluse. And then sometimes you can have a loss of appetite, or you find yourself eating more than usual. Some other symptoms include inability to sleep, which would be like insomnia. So it's harder for you to fall asleep and stay asleep, or the reverse, where you could be sleeping too much. And so that's probably when like the husband they feel like, girl, get up, like the baby crying, and all that kind of thing. And you just don't feel like that connection to the baby. So you don't go and check on the baby. Also, you can feel overwhelmed with tiredness and have just this whole complete loss of energy, and just like a fatigue comes over you. Then you can also have kind of in the mood swing part, just an intense irritability that leads to anger. And sometimes, we hear about those times, those harsher times where the mother hurts the baby or hurts themselves or all of the above. And so that intense irritability or anger could lead to those kinds of thoughts of harming yourself or your baby. So that's something to look out for as well. And one of the things that I notice too is when I see my clients that are, that are experiencing some of these symptoms of postpartum, they have like a fear that they're not being a good mother, that everything that they do is wrong, that, I can't get the baby to stop crying, and, or, whatever that looks like for you, but just that you're not being a good mom. And so just like with other depressive symptoms, there's there's hopelessness and feelings of worthlessness, shame, guilt, or inadequacy, just kind of like with that fear of not being a good mother. And some people even go as far as having severe anxiety or panic attacks. Okay. So I want to also tell you that some of these symptoms can also show up in the partner. So the fathers can also experience postpartum depression and have some of these symptoms. But the most important thing is that when you recognize some of these symptoms, you get professional help. And because untreated postpartum symptoms postpartum depression symptoms can last for many months or even longer. And you want to try to go ahead and get some therapy, which I think we're going to talk about coming up. So, just make sure if you're recognizing some of these symptoms that you do something about them early on, especially when they're like, Glendora, girl, you should have went to the doctor after you was crying because of the wind.
I had to. I ran, and I want us to go over the postpartum psychosis too. So before we do that, I want to bring in Danita Davis. I want to bring her up, and then I'm gonna bring you right back, Juana, because Danita Davis is also a licensed professional counselor as well. And not only that, she's going to talk a little bit more about what is postpartum depression. Go ahead, Danita, and please introduce yourself. Tell them who you serve, babe. Too.
Hello, everybody. My name is Danita Davis. As Glendora has said, I am a licensed mental health therapist and founder of DeKalb Wellness Solutions, a mental and behavioral health agency. We're located here in North Carolina, and we're also servicing clients in Michigan via telemental health, where we are passionate about eradicating the stigma centered around mental wellness, particularly in the African American community. We do that by offering counseling sessions, wellness coaching, as well as psychoeducational workshops within the community. The population of people that we serve are dealing with a lot of mood disorders, anxiety, depression, life transitions, women dealing with self-confidence, and I also love working with our teenagers. My goal is to be relatable and transparent in my approach, while empowering you with the tools necessary to overcome life's challenges. So come on over to DeKalb and check us out, where we provide comprehensive wellness solutions to bring forth clarity. So I know Glendora wants me to get into these. What is postpartum depression, right? That's what we're talking about today, right? Glendora?
Yes, I am. Yes, I am. Yes, I am. Waiting on you to get into it. Yes, I am. That's what we're talking about.
Okay.
Yes, ma'am.
So let's talk about postpartum depression for a minute. So what it is a mood disorder, right? And it affects women after childbirth. And I already heard somebody mention it earlier, but it was typically termed as baby blues, right? And what we don't realize is that it occurs in over 3 million women every year, right? And it typically occurs within the first few weeks after delivery. And it makes it difficult for mothers to bond with their babies and or care for themselves, right? And it's characterized by feelings of sadness, anxiety, hopelessness. We heard Glendora say that when the wind blew, she started crying. She heard the garbage truck was coming down the street and she started crying. And that had absolutely nothing to do with what was happening to her, but there was a hormonal imbalance, right? And when we go through pregnancy, that's 10 months. 10 months, our bodies are changing, right? Our hormones are imbalanced, the estrogen and the progesterone that's in our bodies is kind of thrown off. And some of us go through complicated pregnancies. And when we're going through that complication, it kind of brings about what we're calling the postpartum depression. And it occurs after we give birth. Although we're going through this dynamic, wonderful blessing of our bodies changing to bring forth life, it does do something to us mentally and chemically. And so that's why it's so important for us to address it with our physicians, and as well as providing a therapist that specializes in mood disorders to help us overcome these challenges. And what I want us to do is to remove the shame behind it, because what it's not is not a character flaw. It doesn't mean that there's something wrong with us. It means that we have a hormonal imbalance. There's something wrong chemically. Well, I'm not going to say that there's something wrong chemistry, because it's never really fully understood. But we do know that it's related in changes in our hormones, changes in our brain chemistry, and the fact that we are adjusting to a new role as being moms. And sometimes this doesn't just occur with new moms. It can occur in your second or third pregnancy. It just happens. But the important thing for us is to realize and recognize that there is help available for those who are going through postpartum depression. It is treatable. It can include therapy. It can include medication. There are support groups available for you out here. So don't feel like you are alone. This is something that women experience because we are going through the birthing process and our bodies are changing. And so when we are recognizing the mood change, it's important for us to connect with somebody who can give us the tools to overcome these imbalances. You're on mute.
Okay, all right, yes, ma'am. Because the imbalances is what we wanted to talk about, and so right now I want to jump back in and bring Ms. Wana back, because Ms. Wana want to go ahead and talk to us about the psychosis of postpartum. People don't really think that you can have psychosis, feel like you're crazy, going crazy, because of postpartum. But want to take a deeper dive into the psychosis part of it.
Right. So I'm glad, Danita, you came in and you clarified some of that about the difference between the baby blues and the actual postpartum depression. And so
Oh, I'm sorry.
What's wrong? Oh, it's okay. And so what happens is, like Danita was saying, it's a hormone adjustment to your body. And so you start to recognize these symptoms that I spoke about earlier. And when they get so severe and they go unchecked, y'all, it gets bad. It could turn into what is called postpartum psychosis. So that's why I was urging you, like, if you are someone if you're recognizing these symptoms of the depression part, to go and get help immediately, because it could turn into that symptoms of like feeling more confused and lost, where you also become delusional or start hallucinating. And so that's the psychosis part of this, okay? You can also have obsessive thoughts about your baby. And that's when it starts to get dangerous. And we hear those horror stories about how some lady drowned her kids or something, and I'm not trying to trigger anybody, but those are the stories that we hear, because you start having obsessive thoughts, and sometimes they're delusional, and you start hallucinating that the baby's doing something to you or attacking you and things like that. And those sleep problems get worse because you're not sleeping enough, or you're sleeping too much, right? So then with not getting enough sleep, what happens is that you do start to get confused, lost, and delusional. You see how all those kind of work together? And so, of course, you're not going to have much energy, and you start to feel upset as well. And the worst part of it is that paranoid feeling. And that's, in my opinion, it's the worst part, is because you could start thinking, those obsessive thoughts could start impacting the way that you think about the baby, or even your husband, or just anybody, because you're just paranoid. You might be paranoid that someone's going to take your baby, so and then, of course, it's the last part of where we hear about those attempts to harm yourself or your baby, because those delusions are real. Those hallucinations are real for you, right? And so that's where it gets to be the worst of it all. And so we don't want that to happen. So just, postpartum psychosis leads to life-threatening thoughts and behaviors. That's kind of like in a nutshell of what that is, Glendora.
You know what? I wanted to just reiterate something that you said, because a lot of people don't think like this or understand that this happens. But you said the father can actually take on the postpartum symptoms.
Yes, the father. Do you want me to talk a little bit more about that?
Yeah, I do, because I noticed, like, when I was pregnant, I noticed, like, my husband slept so much. He just got so tired so much, and he was so hungry. Okay.
Right.
So I feel like he was taking on some of the pregnancy symptoms as well. So just like they can take on the pregnancy symptoms and start to crave food and become super extra tired, they also can take on the psychosis or just our symptoms, period, related to depression after the baby gets here. So go ahead and speak on that.
Yeah, and so some of the studies that we've come across show that especially new fathers can
Mhm.
experience postpartum depression, as well as the mother, just like how they take on those pregnancy symptoms too, like you said, and my husband as well. And so sometimes they do feel sad, they feel tired, they feel overwhelmed and anxious, just like we might. But again, they're a new father too. They've never experienced, this taking care of a child either. And so they also show these symptoms of having unusual eating or sleeping patterns. And they can, like you were saying, they can beat up into the psychosis as well, because they also may not be getting enough sleep. They also are being challenged by these experiences of this new being. And so some of it, I do believe, comes from, like, it used to be just me and you, babe, and then now there's this baby, and the baby's taking place, so then, or taking your place in a sense, or you're spending more time with the baby. The baby may be bonding more with the mom than the dad, and so he can also start having those thoughts of not being a good father, or and leading into those obsessive thoughts too, and to where he also may want to harm himself, the mother, or the baby, or a combination of all. Sometimes the paternal postpartum depression can have the same negative effect on the partner relationships, okay, and the child development. So when I'm talking about, like, him having these thoughts of, how he's impacted by it, but it also impacts their relationship together as, so if you start recognizing your partner being more angered or irritable and things like that, then that's going to impact your relationship as well. And, hopefully it doesn't lead to abusive tendencies or things like that. But if you or your partner are having any of these symptoms, I urge you, whether it's the depression or the anxiety parts of it, I urge you to please seek out healthcare providers.
Yeah, we're gonna get into that, but before we do, I want to bring Danita Davis back one more time and tell us, not, well, maybe more than one more time, but right now, she brought us up a actual statistic about the percentage of how many people are out here that suffer from postpartum. Say that again for us, Danita.
3 million women per year.
That's not even
a lifetime, not every 5 years. 3 million women every year.
So that's, again, not even including the men.
That doesn't
So if
include
it's
the
3
men.
million women, then for Juana to tell us we need to be looking out for our men as well. Because like I was saying earlier, Juana, I was saying earlier, my husband had he was tired, super, like, when I thought he was carrying a baby. He was so tired. He was eating every 2 hours. Like, don't you want some of this? The baby wanted. I'm like, okay. I put Doritos on my stomach. Would you stop it, sir? But 3 million, Danita, you say. and that's women only. But Juana said, y'all be mindful of your men.
Yep.
Yeah.
Be mindful of your men.
And I think a lot of times, just in general, our men get overlooked about things, and they don't even, I know this is kind of off, but they don't get those same supports as we do as women, and they just kind of get left out there in a sense.
Because we know we give them that the stereotype of be strong.
Be strong.
But you know what? Well, let's get into how to treat this postpartum, okay? So with that being said, I'm gonna take you ladies back into the back and bring up Miss Felicia Cameron, and let's see how we can literally treat this, because the treatment that we might be able to do for the women, it might be possible for the men. So let's hear about it.
Well, thanks, Glendora. Thank you for this opportunity so I can talk about treatment for postpartum. So I want you to paint a picture with me. I work with this client named Brandy. Brandy is a Black female in her 20s. This is her first child. She lives with her boyfriend. Brandy has very little information about how to really care for a child. In her life, her mom was in and out of her life. And so she goes for her visit with her doctor, and she scored really high on an assessment tool. And based on the protocol of the doctor office, they refer her to a support group, a local major support group here in Mississippi. And so part of her being connected to this support group, peer support group for moms with postpartum depression, I am connected as one of the therapists. There's several therapists on board, and we offer service for individuals who need more than a peer support group. If they see that an individual come in for peer support, but they need more individual, they will refer them for a therapist. And so Brandy got referred to me for psychotherapy. So what did Brandy treatment look like with me? So of course, her treatment, I start off, she was in this peer support group. Also her treatment, her doctor did recommend medication. Of course, Brandy, she didn't want to take medication, because even though her doctors talk about how this medication is safe for her, she's decided that she wants to breastfeed. And even though he said that the medication is safe, even for her breastfeeding, she still having concern that I'm not want to take medication. But she did say, I will agree to do the peer support group and give therapy a try. So with therapy with me included, that she meet with me weekly for psychotherapy, as I call talk therapy, as we call it, CBT. What I use CBT, cognitive behavior therapy. Not only that, but since she's a part of this support group, one of her requirements and part of her treatment was we have to do assessment to the Edinburgh postnatal depression screening every time we meet. And so that was also part of her treatment. Additional part of her treatment that we work on together was including, as they call it, bright light therapy. As I said, Brandy, I need you to get outside, even if it's on your back porch, front porch, but also get some light into it, including with the psychotherapy with me, as well as doing a peer support group. I also have recommend, because Brandon, like I said, she lived with her boyfriend, and I did notice in counseling session that couples therapy would be something that would be beneficial for them. So I did suggest that they do couples therapy. And so Brandy, her treatment with me was virtual telehealth, because again, this is a newborn she had. She was concerned about coming into the office because the newborn has not had all their shots. And again, like I said, this is a first-time mom. And so we agreed together that we will meet by virtual telehealth to do her session. So what are the common treatments for postpartum? Now, common treatments is very based on the type and the severity of the symptoms. And most of the time we just think about women, but I want to make sure you're aware it's not just for women, it is also for men. So common treatments include, anti-anxiety or antidepressant medication, or as they call SSR, meaning that if that's Paxil, Prozac, Zoloft, etc. Sometimes the doctor recommends some individual take medication. I do want to say, even though if a person take medication, it does take a while for that medication to get in their system, their body. But not only that, it also takes several weeks for it really to affect the symptoms that they are experiencing. And so if you are going to do medication, I always, as a therapist, recommend that you do therapy with it, talk therapies. Another treatment could be like actually going into a treatment facility or hospitalization. That's for those who have an extreme severe cause or postpartum where they have to be hospitalized. Additional treatment is ECT therapy. That's where, and that is for extreme cases as well, as where they have to use small electric currents to pass to the brain to help them with depression. Bright light therapy, as I call it, sunlight therapy. That was one of the things that I had recommended for Brandon, meaning get out. The sunlight can increase your alertness and increase balance your serotonin. So even light therapy. Interpersonal psychotherapy, as I call it, couples therapy, as another treatment. And the main one that I really recommend is psychotherapy, talk therapy. And the specific one is CBT, cognitive behavior therapy. So with CBT, it helps individual learn better ways to cope and to deal with their feelings and to know how to respond in a more positive way. It is short term, problem oriented, and it really focuses on people dealing with and understanding their thoughts and their feelings and how it really influences their behaviors. CBT help people to identify their thoughts, evaluate their thoughts, explore, change, and get a new perspective. Yes, it also help with coping strategies, and there's tools, for instance, like homework assignment, maybe journaling, problem solving, or even teaching mindfulness or relaxation or exposure therapy. So let me get back to it. I bet you wonder, so how is Brandy doing? So I have been working with Brandy now for 3 months. Brandy, I told you she had one of her treatment was including to do an assessment to the Edinburgh, which is a postnatal depression screening. The highest score you can make on that is a 30. When Brandy came in for her first session by virtual telehealth, she had scored a 25. Now, 3 months in, Brandy's score is an 8. She is better improved. She got better coping skills. She is better able to understand, identify, and even try new perspective on her behavior. Not only that, instead of doing weekly session now, she is now on bi-weekly. So, and even she need less support she beginning from the support group. So I want to leave you with this, my motto. Do life, but don't let life do you. You can do this, and you got to do this. Back to you, Glendora. You're on mute.
I guess today is just gonna mute me, right? I am not. Listen, I'm just so happy that you was able to highlight the treatment part. I'm super excited the way you highlighted the treatment part. That's why we're doing these mental health panels, because we really want to have the people who watch them really feel educated, inspired, and motivated on living healthy mentally. And especially when you're going to go into these facilities, and you looking for help, you trying to reach out to somebody to help you. And so when you came up here and you talked about this treatment, I love the fact that you said that she could have tried medication. A lot of people who have babies do not want to do medication after they have a baby for breastfeeding purposes. I personally, transparently, I did not want to do medication. I went to the doctor after I realized I was crying because the trees was moving. And she said, Glendora, you're going through postpartum. And she gave me Paxil. You mentioned Paxil, right? And I remember taking a Paxil. It wasn't a prescription. She had them in the office because they got sample packs, I guess, or whatever. And I remember taking them home, and I was just looking at them, and I was like, what we ain't finna do is start this journey on medication. So you finna mind your matter over this. And that's what I did for myself. And that worked for me. But it don't work for everybody. Some people do need medication. So I'm glad that you pointed that out. But like me, Brandy was like, I don't want it. I don't want it. So with that being said, you said, okay, well, part of her treatment was going to be a support group. Okay, which the support group had a licensed professional involved. Did y'all hear that part? She said, I worked in the support group, so that's part of her treatment. Now, this licensed professional, Miss Felicia Cameron, okay, she not only had the resource where she connected herself to a support group to help women like Brandy, right? But she specialized in cognitive behavior therapy, right? So talk therapy. But she didn't just let Brandy come. I'm doing this for a reason because I really want people to understand what the treatment should look like or what it can look like to be effective. So she told her about the medication. Brandy said, So she said, well, you know what? Here's a support group, and it's connected to a licensed professional in mental health because you're going through postpartum. So you're not just going through a support group full of moms, you're going through to one that is going to be guided by a licensed professional in mental health. Then she said that only that the licensed professional specializes in talk therapy, cognitive behavior therapy. Then she said each week, did y'all hear this part? Each week when Brandy showed up, she had to do a self-assessment as part of her treatment. So she didn't come every week and just talk. She came and she was transparent and honest with herself first with this piece of paper. And that is one of the tools that Felicia used in order to help Brandy move through this journey. It helped her. So it wasn't just the talk therapy. It wasn't just the support group. She also gave her an actual tool that she had to use each time she showed up to help them gauge how she's doing. Okay, that was intentional. That was on purpose. That was part of her treatment plan in order for her to heal and overcome this postpartum. The other thing she said, she also implemented another tool for Brandy, which was light therapy. And this is something that Brandy did not have to go and purchase. She told her, when the sun come up, step outside. Okay. I am so happy that you said all of that because people need to really understand, what do mental health treatment look like? And it's not just, I need to go run my mouth and just talk about and complain about where I'm at, or how I'm feeling sad. No, it's about showing up when you have resources, or the resource of the support group, the resource of the therapist that's actually in the support group. So it ain't just a support group of soccer moms. Okay, it's not only did I read that therapist that's in that support group, she showed up with tools. She came with prepared with tools. Oh, well, we're gonna use this, and we're gonna do this every week, so you can see how you doing, and I can see how you doing, and then we can implement a little bit more. We're gonna try this form of therapy too. I am super excited that you said that because that is truly some treatment, and I'm also glad that you also mentioned the men, because apparently that is the theme of the day when we talk about postpartum is men. Okay. And just real quickly, repeat what you said about the men, and then we're going to jump into this coping.
Well, I did encourage because even while doing a session with her by virtual, I did offer as a one of support that her boyfriend do attend the session as a support for her as well. By hearing things that he has encountered and how is affecting her. Of course, he declined, but I did offer it. So I do want to encourage, that men do seek therapy where it's individual. So the second option, what I said, well, let's offer the option of y'all do couples therapy if he's not able to do individual. So for men to even go to therapy, either individual or as a couples, but to also get the resources as they need as well.
Okay, well, you know what? I'm going to bring you back and we're going to talk about the risk factors, all of us together. And that is one of the things that came up. So definitely stick around and I'll be right back. We're going to bring you up right now Miss Marquita, and we're going to talk about the coping. How do you cope with postpartum depression? Oh my goodness, because I was with that. I got to be this mind over matter after I did my coping skill, taking my behind to the doctor and getting the medicine. Then I'm like, I don't want it. Okay, fix it. So tell us how a better way to cope instead of the mind over matter. I don't know why I keep doing that.
When I first think about the whole postpartum depression diagnoses, like it brings me to a story of one of my clients that I had. We'll call her Amanda. I had the pleasure of working with Amanda after she had her first child, and so we had started working together. And then she had gotten pregnant again within a year or so of having her first child. And so the difference between the two periods of her notably having her first child was that her recovery period was quickened. Before she had her second child, when she had her first child, she had 3 months to recover from having her child. She was able to stay home and do the 12 weeks of FMLA. But with her second child, she had just started a job and she didn't qualify, or she didn't meet that deadline as far as working at a job for a year. So she wasn't able to get that FMLA. And so during that time when were continuing to work with each other into after she had her baby, I noticed there were some differences in regards to the way she was showing up during treatment or during our times together. And so we had noticed that she wasn't sleeping as much. Even if the baby was sleeping, she was suffering from insomnia, as mentioned by Danita, and also Juana, that she was barely eating. So she would forget to eat at times. She'd be like, I fed the baby. I don't even remember if I ate today. And so that part, so I would encourage her to like keep snacks around and things of that nature. And then she became like immediately withdrawn from her family, even the immediate family, such as the mother-in-law and her mom. She just was very much just submerged into her role as being a mom, which is normal at times. However, she didn't want anybody to see her. And so we noticed a decline, and we immediately just started to talk about like possibly having postpartum depression. And we went through the criteria, and it was apparent that that was one of the things. So together we came up with a plan of how to alleviate some of the pressure from being a new mom. Even though this is her second child, this was her second child under the age of 3. And so thinking about the weight, thinking about the pressure, thinking about the responsibilities that came with that. So these are some tips that I had came up with, and that some of these things we did together, and some of these things I just have in my repertoire, knowing like these things can work as well. So the first tip was to seek professional help. Talk to your doctor. Talk to your OBGYN and identify like, hey, I just haven't been feeling myself. I just haven't, I have this feeling and I just can't shake it. I want to be happy. I want to be here, but I just find myself having this heaviness over me. Talk to your mental health professional. These both are people that you possibly have in your life. And so with me working with my client, I was able to tell like there was a shift in her, because I was able to see her prior to having the baby, and then after having the baby, and noticing that difference. And then also with me and her working together, as well as her talking to her doctor, although she wasn't able to meet the medical FMLA because she didn't meet the yearly deadline, once she had her baby and once we noticed the symptoms and things like that, she was actually able to qualify for mental health FMLA or short-term disability based off of the symptoms and the criteria of having postpartum. So the first one is to seek and talk to a professional about the symptoms that you may be having. The next one is to practice self-care. So make sure to understand that this is a transitional phase. Everybody's in transition, and this is a new addition to your family. Give yourself some time, give yourself some grace. We all know that having a new child can be demanding, but also having these things set aside for yourself, like in your home. Have things set aside, like if you like chocolate, have your whole playlist of videos or movies or whatever that you're going to watch. Drink a cup of tea, take a walk, listen to your favorite artist, or read a book. But practice self-care during this transitional phase. Remember that you can't pour from an empty cup. And so it's important that you take care of yourself. The next one I had is just to build a support system, a support network. Oftentimes when you have a baby, everybody wants to help. They really do. They want to help. They want to know, like, what do you need? You guys need anything or whatever? So it can be, yes, the answer is yes, I do need help. I need somebody to come over and maybe sit down while I take a nap, or I take a shower, or could you guys fix us a meal? I know when I had my child, my church was just like, what do you guys need? I was like, hey, we need some meals. I'll be down. I had a, C-section or whatever. And I'm like, I'll be down for a couple of weeks. Can you guys just help us out there? They sent over gift cards. They sent over meals. The people are willing to help. It's just a matter of you saying yes sometimes to, I do need some help. I need you to come over. Thank you. So don't be shy to take up that request. The next one is mindfulness. So practicing mindfulness techniques such as deep breathing, meditation, those things that helps you to be present, to be calm. Oftentimes, like, this tool is so underutilized. But think about it. When you have your baby, you may be nursing, you may be feeding them, you're sitting there. And yes, you're present, but also, like, try to do some deep breathing. Your baby's already listening to your heartbeat. And so just listening to you go in and out with your breathing, or even say positive words or meditation, whatever the case may be. You can always pop in an AirPod or pop in some headphones and take care of yourself while you're taking care of your child at the same time. As Felicia mentioned, I have on there, join a support group. Connect with other moms that may be experiencing postpartum under, I would say, the supervision of a professional, under a therapist, supervision, or who's moderating the whole group. But it can bring reassurance with you connecting to other individuals, and it can help to normalize, like, okay, there are some things that I'm going through with that, has anybody else experienced this, and how did you cope with that? And so having a support group can be helpful because you realize, like, I'm not the only one. I'm not alone in this. Stay active. That's the next tip. So with the doctor's thumbs up, go out there and engage in some type of physical activity. I would say start slow, start small, such as taking a walk, putting the baby in a stroller or putting them in the carrier and taking a walk, doing yoga, doing some, again, meditation, moving your body, going swimming if you're healed, whatever the case may be. Also, setting small goals. Most of the times we pressure ourselves to try to get back to what we were pre-baby. We try to get back to that whole snapback or whatever the case may be, or get back to who we were. And you have to really take in the idea that you're not the same person that you were prior to having a baby. You're not that person, and you have more. Your body just went through a whole 10 months of carrying and birthing a child into the world. And so setting small goals such as, like, okay, today I ate, the baby ate, nobody died, a win is a win. If you look at, like, the energy that you have and that's all you're able to do, you're winning. Just take it moment by moment, day by day. The next tip I have is just to practice positive self-talk. Reframe any of those negative thoughts that you may have with affirmations. So this can help to build self-esteem as well as confidence in your new role. No matter if you're a second, third, fifth-time mom, it's still an adjustment. You know that?
Yes, I love these tips. I love them. I want us to get into some of the risk factors. So I'm going to bring Danita back up, and I'm going to bring Felicia and Juan. And as we get into this, y'all, go ahead, Danita. Give us 3 risk factors that we should be mindful of when it comes to postpartum.
A couple of the risk factors is some of us who have a history of depression and anxiety. We're more likely to experience postpartum depression, right?
Mm-hmm.
Sleep disturbance is another one, and I'm stumbling because I suffer from sleep disturbance, and I ain't even had no baby. My youngest baby is 26, right? But yeah, sleep disturbance is one. And then another one is pregnancy and childbirth complications.
Okay. All right. Felicia, give us 3.
One risk factor is financial problems. Client I was talking about, Brandy, she was financial problems. Just had a baby. Now I'm not able to work anymore. And so now they're putting a strain on the person she's living with, the boyfriend. Now all the responsibility on him. So financial problems is a risk factor. Another risk factor, problems with the relationship. It goes back, if you living with your partner, your spouse, and now it creates, as one of the therapists said, communication, and feel like the baby's getting more attention. They especially this is the first child or second child, and just see that the partner, spouse, seeing that the baby's getting a lot of attention. Sometimes attention that causes problems, even problems communicating. So problems within the relationship that I saw within my client Brandy with her partner. Weak, another risk factor, weak support system. Go back to Brandy. Brandy, I told you her mom was in and out of her life, so she didn't have that. Okay. Only person she had is this boyfriend that she lived with, and it just really, really them. And so many times people have a weak or not support system of those family and friends to help them out. So that can be a risk factor.
Okay, Juan, what you got?
Yeah. One that really sticks out to me is when you got multiple. So if there's twins or triplets or just multiple, because you can feel so overwhelmed real quick. If you already got one, I can't imagine having two or three of them little things at one time. So just when you think about that, that puts you at a higher risk. Also, as I mentioned before, just the breastfeeding, because you don't get to, you don't feel bonded or connected to your baby. So I think that's another good risk factor is just difficulty breastfeeding. And the last one that I was thinking about is, especially for these young mothers or people that have unplanned pregnancies or unwanted pregnancies, that puts them at a higher risk because, of course, they didn't feel that they wanted the baby. They don't want to have it. Now it's here. What am I going to do? I got to take care of it. And as I think it was Felicia mentioned, you may not have that support system. So, just having that unwanted or unplanned pregnancy.
Yeah. Okay. Marquita, you have any risk?
Yeah, so another thing is just having a pregnancy around stressful events. So I know that COVID was a huge stressful event that a lot of people had trouble with. As far as not being able to have the parents or have your spouse in the room with you when you're giving birth, that could lead to difficulty after the baby and just not feeling like you're able to bond and things of that nature. Also experiencing the baby having health problems. That's another thing where you're feeling like overwhelmed, going back to some of the symptoms of feeling like you're failing as a mom, you're not able to care for this child in the way that they need. So yeah, that's some of the risk factors.
And I would just throw in one too. Another one that is major is if you already been diagnosed with bipolar, having a baby can trigger that. It can trigger your symptoms to come back out. So if you have a history of depression or a history of bipolar, it's something that you want to just be mindful of if you're pregnant and you're going to have a baby, that you want to just have a little bit extra care around your mental health, because this is going to get your hormones all unbalanced. Okay, you guys, I cannot appreciate and thank you guys enough. Before we get out of here, I want each of you guys to come on here and just say, name your company again, your contact phone number so they can reach out to you, and your motto. So come on, Danita, start us off.
I am Danita Davis. I am from DeKalb Wellness Solutions, where we are based out of North Carolina and provide telemental health also in Michigan. We provide comprehensive wellness solutions to bring forth clarity. My contact number is area code 704-956-9566.
What do you like to lead the people with, Danita? What do you want them to remember?
I want you to remember that help is available.
Amen.
It's okay to not be okay, but it's not okay to not get help.
And that's something that Marquita was just saying too in the coping skills. She was saying it's okay to say, yes, I need some help. Yes. So come on, Felicia, tell us again who you are, who you represent, the contact number, and what do you want the people to remember?
So again, my name is Felicia Cameron, licensed clinical social worker for the great hospitality state of Mississippi. My contact number is 601-317-5997. And I do have an offer for everyone that's listening to the live. I have a free download for you. Okay. Marquita had mentioned about in her coping techniques is affirmation. And I have a free download where you can get some positive affirmation. For instance, let me read one of them.
Okay.
As a new parent, I sometimes make mistakes, but I choose to learn from my mistakes and let go of the need to be perfect. The most part of being a good parent is to love my baby and give them my best. And I do this every day.
Amen.
So I want you to, in order to get this affirmation, I have a total of 6. You just provide your email, and now you'll get these affirmation in
What's
the
the
email.
link? Tell them the link to get it, to provide.
It's through Linktree, lending my hand.
Okay, and it's in the comments too, you guys. Say it one more time.
That's a Linktree, and it's lending my hand.
Okay, all right. Thank you for that. Come on, Ms. Lyles.
Well, hello again, you guys. Thank you so much for joining us. My name is Wanda Lyles. I am the owner of LIT Wellness Center. That is LIT Wellness Center, where we help people to overcome their trauma, their depression, and their anxiety, because yesterday is gone. You ain't got to be in that depression. And tomorrow ain't even promised to you, child. So don't even be having some anxiety about that. But so yesterday is gone. Tomorrow is not promised. So live intentionally today. My contact number is 334-614-8007. So if you're in Alabama or Georgia, I got you.
Yes. Let me tell you, she said that depression is gone and you ain't got to worry about this anxiety for tomorrow. Do it today. Okay. Come on, Miss Marquita Mahogany Bridges. Tell the people what I'm talking about.
Hello, my name is Marquita Thompson. I am in the state of Ohio. I am the founder of Mahogany Bridges Mental Health Services. I work with individuals who have been impacted by childhood, generational, as well as societal trauma. And so my goal is just to work with you in order to have you to feel empowered, as well as embracing your story and feeling as if you are in a safe space. My contact information is marquita@mahoganybridges.com. My phone number is 937-342-3955. And I would like to leave you guys with my motto of therapy is the bridge that gets you from trauma to healing.
Amen. Listen, Marquita, when you were just saying that, you were reminding me of the fact that I was going to say something about, you were saying about the trauma say the motto one more time for me.
Therapy is the bridge that gets you from trauma to healing.
And see, and then all you gotta do is just take the step to come to therapy, right? And then you can go from trauma to healing. I love you guys mottos. This has been hopefully it was been inspirational and motivational for somebody that may listen to us. And if you can, share this out, because it might not be you, it might be somebody that is connected to you on your social media. And what we're doing is just trying to bring some healing and laughter. And you can laugh if you want to, because we laugh all behind the scenes today. But listen, you can laugh if you want to. I am Glendora Divine. This is Mental Health Awareness Month. So we are really just trying to make sure that you are aware on how to live intentionally today. Sound like lit, don't it? Okay, y'all. Thank y'all for joining us, and we'll see you next week. We coming back. Bye.